Hi, I'm Erica Tavares. I'm with International Medical Corps, and we're standing here at the Pasadena Convention Center, one of the largest shelters for those who were evacuated by the devastating wildfires that have affected those in Los Angeles County over the last several weeks. International Medical Corps has been on the ground since January 8th. We were here within 24 hours of the fire's outbreaks, and we're providing a comprehensive set of services to help people get the urgent relief and care they need right now. We're able to bring 40 years of experience responding in low resource environments when we might not have all of the tools that we need, where we have to be really flexible and adaptable and innovative and on our feet. That's what we're kind of bringing to this response. Just like we do anywhere else in the world, International Medical Corps' approach to this disaster is one of collaboration and partnership. That means that we partner with organizations like the American Red Cross, who is running the shelter, or CalEMSA, or the Los Angeles City Mayor's Office. International Medical Corps has implemented a county-wide response. We're here in Pasadena today, but we've also got responders who are providing medical care in Westwood. We have responders providing medical care at the site of the Hughes fire. We've got mental health providers in Santa Monica, and we're really out throughout the county in communities, really looking for those places where there's a gap in regular healthcare, there's a gap in mental health care, and we can come in and fill those gaps and provide those services and needs. We've also distributed over 20,000 relief items to shelters, to local organizations, to distribution centers, to government agencies to really keep everybody safe. And we've delivered mental health, again, in non-traditional sites all across the county, indoor, outdoor, public libraries, and wherever it is that it's needed to meet people where they are. People are on the move. They're going back into their homes. They're evacuating to new spaces or finding new residences as their communities are rebuilding. And so wherever the mental health care services are needed, when we get that call from the Red Cross or one of our other partners, we're able to take our teams, pivot, and provide the care that's needed. We're also partnering with federally qualified health center partners, those facilities that work with un or underinsured patients that really support the most vulnerable in our community, to make sure that they have the resources to provide care for their patients, whether they're displaced or they're just trying to get back on their feet, but also to support the frontline health workers. You know, when a disaster like this happens, many forget that the frontline health workers who are out there trying to provide ongoing medical care are often affected themselves. And so we're offering support to those facilities so that workers affected by the fires can get housing, they can get the resources they need if they've had to evacuate, they can get some of their costs covered. We're also looking at helping patients. You know, do patients need to have their co-pays waived or have prescriptions filled because they just don't have the funds or resources given everything that's happened? We're really working with them to make sure people have the tools, the resources, and the healthcare staff that they need to be able to continue to keep themselves healthy when they're going through this recovery process. People have lost their homes, they've lost their neighborhoods, they've been displaced, and it's going to take a tremendous amount of time, energy, and effort for people to recover for that and begin to rebuild their lives. As an organization that is founded in Los Angeles in 1984 and has been here for 40 years, we are incredibly committed to making sure that we're doing everything we can to help those affected. We're going to continue to fill gaps in healthcare, provide mental health services, work with health facilities, and work with local organizations who are continuing to provide services and rebuild this community back to where it was before.